Hi, my name is Beatriz Tapia. I'm a senior lecturer for the Health Science Center San Antonio, the Regional Academic Health Center in Harlingen, Texas. I teach environmental medicine and public health. I also have a dual faculty position at the School of Public Health and at the School of Medicine.
So if you can just briefly explain what what role the Latino caucus has played in your development as a public health professional?
The Latino caucus for me has been pivotal in helping me network with other Latinos, senior Latino researchers, and network with young professionals that are very keen to acquire the opportunity to improve the health of Latino in the United States.
And how did you get to where you are today? If you could briefly explain your background and what inspired you to pursue public health as a Latina.
So what inspired me to go into public health is because as a physician, I found myself treating individuals coming in for the same reasons, and I could not find the cause. I would treat them at the individual level, but I found myself lost. So in order to make a difference, I found myself struggling, and that's when I found public health. Public health helped me, inspired me, and helps me serve a population that is truly in need. It inspired me to make changes that I did not think I could do as a physician, and I found that public health gave me power in my community to make changes that as a doctor I could not. I value public health to an extent that I have students that are now doing their master's in public health as medical students, and that has given them a broader perspective of not thinking of the individual basis, but thinking at the community level.
And were there any stumbling blocks along the way? We could briefly explain what some of those challenges might have been for you.
A lot of people talk about challenges. I say they're opportunities. The opportunities that you have being Latino give you an inner perspective of what you could do to change your community. So with that, I don't think it's a challenge. I think it's an opportunity for you to make a difference. There's few of us at the professional level, but that doesn't mean we can't make a change. I think we can inspire others to make a lot of difference in the community they serve. It doesn't take a village, it just takes you wanting to make a change.
And what advice would you give to a Latino student who's pursuing public health as their profession? And what do you wish someone would have told you when you were also pursuing your profession in public health?
That's a loaded question. One of the major challenges being a young professional and being Latino is that there was not a lot of mentors for me, but I think that if you look hard enough, you will find somebody. It doesn't have to be a professor. It could be a community leader. It could be somebody that inspired you to make change. And if you get close to that person, you will definitely see the opportunities to do public health at the community level, and that will translate at the university level, and that will translate at the policy level. So inspire yourself. It's really just wanting to get out there, get your feet wet, your hands dirty, and make a change.
And what do you wish someone would have told you when you were pursuing your career?
What I wish somebody would have told me when I started public health is that it takes a lot of passion to do what you want to do. There is barriers in terms of funding, but that doesn't mean you can't do it. You have to knock on the doors many times, and that could discourage you, but I will still do that route because it's an uphill road. As a Latino, you have a double standard, if you will. Sometimes you think you're not privileged enough to be in a space, and that makes you set the bar higher for yourself and to prove yourself. It's challenging, I must say, but you can make a difference. You are a leader. You have it in you, and don't think of yourself as less. You will make a change.
And last two questions are dealing with research.
Okay.
So
I'm good at that.
So what are some of the skills that researchers need to advance in their careers in public health?
I think as a young professional that's going into the track of research, there is opportunities that you could take in not reinventing the wheel. I would definitely approach senior public health researchers, even if their field is not Latino. You could definitely cater these community intervention projects to Latinos who have that skill set. I would also say that tidy up on your writing skill. I think that's one of our major limitations as Latinos. I find that when I read research papers, sometimes they're not written in an appropriate fashion. I would definitely take a grant writing course. I would take a statistical course, and I would do an internship, even a volunteer, non-paid internship that will give you the opportunity to expose yourself to community projects, to research projects, even at the university level. I got my first opportunity just knocking on doors. Nobody gave me the opportunity. I looked for it. So I think as a young professional that wants to do research, see what you like and find the people in your community, and if they're not there, look somewhere else and email them, and they'll give you ideas. As researchers, we're always keen to try to bring in younger individuals that have passion, because that's what you have, a lot of passion.
And last question is, what is different about public health research compared to other kinds of research?
That's another question. Okay. What is different about public health research as compared to other research is that it probably takes a long time to do the policy development to make change. I think we have a lot of public health research available, but in order to make policy change, it's challenging. I think I forgot the trick. What else?
Sure. Yeah. So, what is different about public health research and public health research careers compared to other kinds of research?
Okay. What is different about public health research careers? Okay. I think the struggles. Yeah. I think in terms of public health research, you're always right now. The time we're living, it's the lack of funding, and in terms of public health research, we don't have a lot of money coming our way. That is one of the major differences, I would say, with other types of research. When you look at clinical research, there is some incentive to do that. With public health research, there's not a lot. But I don't want to discourage anybody. I just, I think we have to say the truth of that, and I think that's sometimes when we change our focus in terms of research.